The emergency department at County General smells like disinfectant and burnt coffee at 6:47 in the morning. Fluorescent lights hum overhead, casting everything in that particular shade of institutional white that makes people look sicker than they are. The floors are polished to a dull shine, still wet in places where the night shift didn't finish mopping. Sarah Chen pushes her cleaning cart past the triage desk. 52 years old, hair more gray than black now, pulled back in a practical bun. Surgical scrods that hang loose on her frame, 2 sizes too large, the fabric worn soft from industrial washing. Her name badge reads, Environmental Services, in plain block letters. She doesn't look up when the residents pass. Jesus, they've got the old lady cleaning again, Dr. Marcus Webb says. 28, fresh out of residency. Yale diploma mounted in his office, right next to his undergraduate degree from Princeton. He doesn't bother lowering his voice. His companion laughs, a short bark of sound. Didn't she apply for a nursing position, like 3 times? With what credentials? I heard she's got some community college certificate from the 90s, maybe earlier. Webb grabs a coffee from the station, doesn't say thank you to the nurse who handed it to him. I mean, I respect the hustle, but there's a reason she's pushing a mott. They disappear into the conference room, voices fading behind the closing door. Sarah's hands don't pause. Spray, wipe, move to the next surface. Her movements are economical, efficient, the kind of efficiency that comes from muscle memory so deep it doesn't require thought. She finishes the triage bay, the waiting area, moves toward the equipment storage room. At 7:03, a crash cart rolls past her, wheels squeaking against the linoleum. She glances at it, a look that lasts maybe 2 seconds, and her eyes narrow. Hey, her voice is quiet, firm. The nurse pushing the cart doesn't stop. Not now, Sarah. The defibrillator pads are reversed. The nurse's stride falters. What? Positive and negative. They're backwards. The red lead is on the left side. The nurse stops completely now, turns, looks down at the equipment tray. Her face goes pale. I prepped this last night. How did you even? But Sarah has already returned to her work. Spray bottle in hand, wiping down the nurse's station counter with the same methodical attention she gives everything else. The nurse stares at her back for 3 full seconds, mouth slightly open, then hurries away to fix the setup before anyone else notices. At 7:30, Dr. Webb emerges from the conference room with his team. 4 residents, all of them young, all of them eager. They're discussing a case, voices animated. Sarah is emptying a sharps container nearby. The presentation was textbook. One of the residents says, acute MI, ST elevation in leads 2, 3, and AVF. We got him to the cath lab in under 40 minutes. Webb nods, pleased. Door to balloon time is critical. That's the difference between tissue death and recovery. Sarah's hands pause for just a moment on the biohazard bag. His nitro drip was set wrong, she says. The words are soft, almost conversational. Webb turns. Excuse me? The patient this morning, VMI. His nitroglycerin drip was set at 15 micrograms per minute. Should have been 50 for his weight and presentation. The residents stare. Webb's jaw tightens. That's not really your concern. Maybe not. Sarah seals the sharps container, locks it. But the patient had persistent chest pain for 90 minutes because of it. The nurse caught it eventually, changed the dose. Pain resolved in 6 minutes. Webb's face flushes. How could you possibly know that? Sarah lifts the container, places it in her cart. I pay attention. She walks away, cart wheels clicking softly against the floor. Behind her, one of the residents whispers, Is she right? Webb doesn't answer, but he pulls out his phone, checking the chart. His face. Can I ask you something? And please don't take this the wrong way. Sarah waits. Why do you work here? In the hospital, I mean, if you're not medical staff. Sarah places the last box of gauze on the shelf, turns to face the student fully. Because people need clean spaces to heal, she says. Because infection control starts with environmental services. Because someone has to make sure the equipment is where it needs to be when seconds matter. The student blinks. That's actually a really good answer. It's the true answer. Sarah moves past her, into the hallway. In her pocket, beneath the latex gloves and the small bottle of hand sanitizer, there's a coin. Tarnished brass, heavy, the edges worn smooth from years of handling. On one side, an eagle. On the other, a rod with a serpent coiled around it. The staff of Asclepius, symbol of medicine. Inscribed around the edge in small letters. U.S. Army, 75th Ranger Regiment, Medical Corps. Sarah hasn't taken it out in 6 years. Won't today either. At 11:20, there's a commotion near the ambulance bay. Voices raised. Someone swearing. Sarah is 2 hallways away, but she hears it. She shouldn't go. It's not her job, not her place. She goes anyway. A paramedic is arguing with a nurse. I'm telling you, the IV blew in Transcourt. He needs a new line now. The patient on the gurney is seizing. Not the dramatic kind, the kind people see in movies. Subtle. A tremor in the hands. Eyes rolled back. Jaw clenched. The nurse is trying. Tourniquet on the arm. Palpating for a vein. I can't find one. He's a hard stick. Sarah stops 3 feet away. Watches. The patient's oxygen saturation is dropping. 94, 92, 90. Try the external jugular, Sarah says. The nurse looks up, startled. What? External jugular vein. Neck. You can see it from here, even without the tourniquet. The nurse hesitates. Looks at the paramedic. The paramedic looks at Sarah. Really looks. Takes in the scrubs, the cart, the name badge. She's right, he says quietly. Go for it. The nurse does. IV placed in 40 seconds. Fluids running. The patient's seizure begins to ease as the medication enters his bloodstream. Sarah is already walking away. The nurse calls after her. Thank you. Sarah doesn't turn around. At 1:30, during her lunch break, Sarah sits in her car in the parking garage. She doesn't eat, just sits, hands on the steering wheel, staring at nothing. On the passenger seat, there's a book. Old, the cover worn. Advanced Trauma Life Support Under Fire, Field Manual for Emergency Medicine. Her name is printed on the spine, not as a contributor, as the primary author. She doesn't open it, hasn't in 6 years. Won't today either. At 2:40, she's back inside, cleaning the staff break room. Someone left the coffee maker on, the pot empty, the heating element scorching the glass. She unplugs it, washes the pot, sets everything right. Dr. Webb walks in, sees her. Their eyes meet for a second. He looks away first. Sarah finishes wiping down the counters, empties the trash, leaves. The day continues, steady, predictable. She cleans, she watches, she says nothing. This is her life now. Quiet, small, safe, no decisions, no triage, no choosing who lives and who doesn't. Just clean floors and stocked shelves, and the weight of a brass coin in her pocket that she'll never take out and never throw away. At 11:34 in the morning, Sarah is restocking Trauma Bay 3 when the smell hits her. Diesel. Fuel, birth rubber, something else underneath, something acrid and hot. Her hand freezes on a box of gauze. The fluorescent lights flicker once, just once, and suddenly the walls aren't white anymore. Kandahar Province, March 2018. The Humvee on its side, flames crawling up the undercarriage like living things. The smell of burning oil and melting plastic, and something worse, something organic. Johnson screaming, Rodriguez not screaming at all, which was worse. Her hands moving, not shaking, never shaking. Tourniquet, pressure, airway, a heat blistering her forearms through her uniform sleeves, fabric melting against skin, and she didn't stop, couldn't stop, because Johnson was 19 and Rodriguez was 22, and neither of them was going to die in the sand if she had anything to say about it. Stay with me, Johnson. Stay with me. Someone drops a metal tray in the hallway outside. The sound is a gunshot, a mortar impact, an IED detonation. Sarah's body moves before her brain catches up. She drops into a half crouch, weight forward on the balls of her feet, hand reaching instinctively for a sidearm that hasn't been on her hip in 6 years. Combat stance, threat assessment, scan for cover. She freezes, breathes, stands slowly, feeling the tremor in her legs, the adrenaline dumping into her bloodstream with nowhere to go. The trauma bay is just a trauma bay. White walls, clean floors, no fire, no blood, no bodies. You okay? Dr. Webb is standing in the doorway, watching her. He saw it, saw the crouch, the reach, the way her entire body transformed for 3 seconds into something else entirely. Sarah's face is carefully blank. Fine, startled. That was more than startled. His voice is quieter now. Careful. You moved like someone clumsy. She picks up the dropped gauze boxes. Excuse me. She walks past him, heart still hammering, mouth dry. He doesn't stop her, but she feels his eyes on her back all the way down the hall. At 2:17, during her afternoon break, Sarah sits in her car in the parking garage. She doesn't turn on the radio, doesn't check her phone, just sits. On the passenger seat, next to the field manual she never opens, there's a small notebook, plain black cover. She opens it. Inside, written in neat block letters, a list of names. Private First Class Daniel Morrison, Ohio, 19 years old. Sergeant Michael Torres, Texas, 26 years old. Specialist Amanda Okonkwo, Georgia, 23 years old. The list continues. 43 names total. 43 people she saved during her last deployment. She turns the page. One name, written alone. Private Daniel Morrison, Ohio, 19 years old. The same name, written twice. She closes the notebook, puts it back on the seat. Her hands are steady. They're always steady. That's the problem. At 3:40, she's cleaning the staff locker room when she hears two nurses talking in the hallway outside. Did you see that custodian correct Dr. Webb this morning? Sarah? Yeah. She does that sometimes. It's weird. Weird how? Like she knows things, medical things, more than she should. A pause. Maybe she wanted to be a nurse, before. Before what? I don't know. Before whatever happened that made her clean floors instead. Their voices fade as they walk away. Sarah continues wiping down the lockers. Her expression doesn't change. At 4:15, there's a code blue in the ICU. Sarah is 2 floors down, but she hears the announcement over the PA system. She shouldn't go. It's not her job, not her place. Her feet carry her to the stairwell anyway. She climbs, fast, taking stairs 2 at a time. Her breathing doesn't change. 18 years of physical training don't disappear just because you stop practicing. She reaches the ICU floor. Slows, walks normally now. The code team is already there. Residents and attending, nurses. The room is controlled chaos. Sarah stands in the hallway, watching through the window. The patient is a woman, 60s, coding for the 3rd time in 2 hours according to the board outside her room. The attending is doing compressions. Push another amp of epi. The monitor shows ventricular fibrillation, shockable rhythm. Charging to 200. They shock. The patient's body arches. The rhythm doesn't change. Sarah's jaw tightens. They're not ventilating properly. She can see it from here. The bag valve mask isn't sealed correctly. Air escaping around the edges. The patient isn't getting oxygen. Again, charging to 300. Another shock. Another failure. Sarah's hand moves to the door handle. She stops herself. Not her job. Not her place. A resident finally notices the ventilation problem. Adjusts the mask. Proper seal now. The oxygen saturation begins to climb. 2 shocks later, the patient converts to sinus rhythm. The room exhales collectively. Sarah turns away. Walks back to the stairwell. Her hands are shaking now. Just a little. She makes them stop. At 6:05, near the end of her shift, Sarah is cleaning the physician parking lot entrance when she sees Dr. Webb loading bags into his car. He notices her. Hesitates. Walks over. Can I ask you something? Sarah continues sweeping. Go ahead. Where did you learn medicine? I don't know medicine. You corrected me twice today. Once about a nitro drip I had to look up to verify. Once about defibrillator pad placement that would have caused a serious problem. He pauses. That's not something you pick up from watching. Sarah doesn't answer. Webb steps closer. His voice drops. And that thing this morning, in the trauma bay. The way you moved when that tray dropped. Another pause. I've seen that before. My brother's a Marine. He does the same thing when he hears loud noises. Sarah's hands stop moving. She looks at him directly. Your brother came home from war, she says quietly. Some people don't, even when their body makes it back. She picks up her broom, walks away. Webb stands there, watching her go, a dozen questions forming that he doesn't know how to ask. At 6:30, Sarah clocks out. Changes in the employee locker room. Jeans, plain gray sweatshirt, running shoes worn smooth at the heels. She opens her locker. Inside, taped to the door, a photograph. 12 people in desert camouflage. Standing in front of a medical tent. Dust and sun and tired smiles. She's in the center. Younger. Hair darker. Major's insignia on her collar. The caption at the bottom, written in faded marker. FOB Shank Medical. The best damn team in theater. Sarah looks at it for 5 seconds, closes the locker, walks out to her car. The drive home takes 20 minutes. She doesn't turn on the radio, doesn't think about Wed's questions or the nurses. Gossip or the way her body still remembers combat responses she thought she'd left behind. She thinks about clean floors and stocked shelves and the weight of a brass coin in her pocket. Small life, quiet life, safe life. No decisions, no triage, no names added to lists. Her hands grip the steering wheel. Steady, always steady. That's the problem. At 4:48 in the afternoon, the ambulance bay doors explode open. 2 paramedics, a gurney, a man in his 30s. Construction vest soaked through with blood, hard hat still strapped to his head. Rebar through the abdomen, the lead paramedic shouts. BP's 60 over palp and dropping fast. Dr. Webb runs to meet them. 2 nurses, a second-year resident named Chen, no relation to Sarah. Their shoes squeak on the polished floor. Sarah is 30 feet away, emptying a biohazard container near the supply closet. She looks up, sees the patient, the angle of the rebar, the way it enters just below the rib cage, exits near the hip. The color of the blood pooling on the gurney, too dark, spreading wrong. Her eyes track to the monitor. Heart rate, 132. Oxygen saturation, 82%. Respiratory rate, 34. Breath sounds diminished on the right side. Tracheal. All deviation visible even from here. Tension pneumothorax. Secondary hemorrhage from liver laceration, possibly hepatic vein involvement, maybe 4 minutes before he's gone. Webb is barking orders. Get me a trauma panel, type and cross for 6 units, and call surgery now. Doctor? The nurse's voice is tight. He's crashing. The patient's eyes roll back. His body goes rigid for 2 seconds, then limp. Monitor alarm screaming. The sound fills the entire department. Webb freezes. Just for a second, but it's there. Textbook knowledge slamming into the reality of a man dying in front of him. Start CPR, he says, but his voice wavers. Sarah moves. Not running. Walking. Fast. Purposeful. Her cleaning cart forgotten. She's at the gurney before Webb processes that she's there. Ma'am, you need to step back. She ignores him completely. Her hands go to the patient's neck. 2 fingers on the trachea. Palpating. Checking position. Needle decompression. Right side, now. Webb blinks. What? We need imaging first. We need to confirm. He has a tension pneumothorax. You have 90 seconds before he codes completely. We don't just stick needles in people based on visual assessment. Sarah's eyes snap to his. The look stops him cold. It's not anger. It's not frustration. It's command. Cure. Absolute. The kind of authority that doesn't ask permission because it doesn't need to. Second intercostal space, mid-clavicular line, right side. 14-gauge angiocath. Get it now or watch him die. The room goes silent, except for the monitor alarm. The nurse moves, grabs the needle decompression kit from the crash cart, hands it to Sarah. Wait, Webb starts. Sarah doesn't wait. Antiseptic swab, 3 seconds. She palpates the landmarks, finds the space between the ribs, inserts the catheter at a 90-degree angle. The needle goes in clean, smooth, no hesitation. There's a hiss of pressurized air releasing, loud, unmistakable. The patient gasps. A real breath. His first in 40 seconds. The monitor alarm changes pitch. Oxygen saturation climbing. 82, 86, 91. Heart rate stabilizing. 132, 128, 118. Sarah's hands move again, checking the rebar entry wound, palpating the abdomen, watching the blood flow. Her fingers press carefully around the edges, assessing depth and trajectory. He's got a liver laceration. Grade 3, maybe 4. Hepatic vein involvement probable. Her voice is clinical, precise. You need vascular surgery and a trauma team in the OR. He's got maybe 18 minutes before he exsanguinates. Webb stares at her. The nurses stare at her. The resident's mouth is open. Sarah steps back. Her hands are steady. No blood on them. She worked around the wound without contaminating anything. Who the hell are you? Webb whispers. Sarah looks at him. Her face is carefully neutral. Someone who empties trash cans. She turns and walks away. Behind her, Webb is already moving, pulling out his phone, calling the trauma surgeon, his voice urgent now, repeating everything Sarah just said word for word. The patient is rushed to the OR 6 minutes later. Sarah is back at her cart, finishing the biohazard disposal like nothing happened. Her hands don't shake, they never do. At 5:15, the trauma surgeon comes down from the OR. Dr. Patricia Osai, 58. 30 years of experience. She finds Webb at the nurse's station. That construction worker, who did the initial assessment. Webb hesitates. I did. No, I mean who diagnosed the tension pneumothorax and performed the needle decompression. Webb's face goes carefully blank. The custodian. Dr. Osai stares at him. Say that again. The custodian. Sarah Chen. She's environmental services. She just walked up and did it. Environmental services. Dr. Osai's voice is flat. A custodian performed a needle decompression in your emergency department. Yes. And diagnosed a grade 4 liver laceration with hepatic vein involvement. Movement without imaging. Yes. How? Webb shakes his head slowly. I have no idea. Dr. Osei is quiet for a long moment. That man would have died. The pneumothorax was minutes from cardiac arrest. The liver lac was actively bleeding. If she hadn't intervened exactly when and how she did, he'd be dead. She walks away, heading toward the administrative offices. Webb stands there, staring at nothing. At 5:43, Sarah is cleaning the staff bathroom when 2 residents walk in, talking. Did you hear about the custodian? The one who saved that construction guy? Yeah. Webb's losing his mind. Apparently she just took over. How does a custodian know how to do a needle decompression? Maybe she was a paramedic before, or an EMT. Then why is she cleaning toilets? Silence. Sarah finishes wiping the sink, walks past them without making eye contact. They stop talking as she leaves. At 6:10, near the end of her shift, Sarah is walking toward the locker room when she passes the trauma bay. The construction worker's wife is there, sitting in a chair, face in her hands, shoulders shaking. A nurse is talking to her quietly. He's in surgery. Dr. Osei is the best we have. He's got a good chance. The wife looks up, eyes red. They said someone saved him. Before surgery. Someone who knew what to do when the doctors didn't. The nurse hesitates, glances toward the hallway where Sarah is standing. Yes, someone helped. The wife stands. I want to thank them. I don't think that's... But Sarah is already gone. Walking down the hallway, not running, just walking. Away from the gratitude she doesn't want. Away from the recognition she can't accept. In her pocket, the brass coin feels heavier than it should. At 6:30, Sarah clocks out, changes clothes, drives home in silence. At 8:40, her phone rings. Unknown number. She almost doesn't answer. Almost. Sarah Chen? A woman's voice. Professional. Yes. This is Dr. Patricia Reynolds, Chief of Medicine at County General. I'd like to speak with you tomorrow morning, 9 a.m., my office. Sarah's jaw tightens. About what? About what happened today. About who you are. About why someone with your skills is emptying trash cans in my hospital. Silence. 9 a.m., Miss Chen. Please don't make me come find you. The line goes dead. Sarah sits in her living room. Lights off, staring at nothing, the phone in her hand, the coin in her pocket. The past she thought she'd buried, coming back whether she wants it to or not. At 6:22 the next morning, Sarah is in the supply closet restocking bandages when she hears the voice. Doc? She doesn't turn, doesn't breathe, doesn't move. Doc Chen? The voice is older now, rougher, worn at the edges by time and pain and things that don't heal. But she knows it. Knows it like she knows the sound of helicopter rotors, the crack of distant gunfire. The way sand feels when it gets in your teeth and won't come out no matter how much water you drink. She turns slowly. Standing in the doorway is a man in his early 40s, beard streaked with gray, faded army jacket over a flannel shirt, prosthetic left leg visible below his jeans, the kind that costs $60,000 and takes 2 years of VA paperwork to get approved. Staff Sergeant Timothy Kowalski. He was 19 when she pulled him out of a burning MRAP outside Jalalabad. 20 when he learned to walk again. 22 when he finally stopped having nightmares about the smell of his own flesh burning. Holy shit, he whispers. It really is you. Sarah's jaw tightens. You're mistaken. Mistaken? He laughs, not unkindly, almost gentle. Ma'am, I'd know you anywhere. You've got the same scar above your right eyebrow. Same way of standing. Same look in your eyes like you're assessing casualties even when you're just stocking shelves. I'm a custodian. You're Major Sarah Chen, United States Army, 75th Ranger Regiment Medical Corps, Silver Star recipient, 2 Bronze Stars. With valor devices, his voice drops. Reverend, the angel of FOB Shank. The nickname hits like a fist to the sternum. Sarah's hand grips the shelf beside her, knuckles white. That woman doesn't exist anymore. Bullshit. Kowalski steps inside, closes the distance. His prosthetic clicks softly with each step. I heard what you did yesterday. Needle decompression in under 20 seconds. Diagnosed a liver lack without imaging. Saved a man's life while everyone else was still trying to figure out which protocol to follow. That's exactly who you are, ma'am. That's exactly what you've always been. Keep your voice down. Why? His eyes search hers. Why are you here? Why are you hiding? Sarah doesn't answer. Can't answer. Behind Kowalski, in the hallway, 2 nurses have stopped walking. They're listening. Faces curious, confused. She's military? One whispers to the other. Kowalski doesn't look away from Sarah. Not just military. She wrote half the trauma protocols NATO uses. She's trained hundreds of combat medics. She's saved more lives than most doctors see in their entire careers. The whisper spreads. 3 more people in the hallway now. Then 5. Dr. Webb appears at the edge of the growing crowd. His face is pale. You're that Chen? His voice cracks slightly. You wrote Advanced Trauma Life Support Under Fire? Sarah closes her eyes, opens them. Kowalski nods. 3rd edition. The one they made required reading for every military physician in 2015. The one that reduced combat mortality by 18% in its first year of implementation. Someone in the hallway pulls out a phone, starts typing. Oh my God, a resident says, reading from the screen. Major Sarah Chen, retired 2018. 18 years of service. 6 combat deployments. She has citations from 4 different allied nations. The hallway is silent now, except for the hum of fluorescent lights and the distant sound of monitors beeping in patient rooms. Sarah stands perfectly still. Her body remembers how to do this, how to be looked at, evaluated, judged, how to stand at attention while people decide what you're worth. Webb steps forward. Why didn't you tell anyone? Because I didn't want anyone to know. But you could be saving lives, teaching, working as a physician instead of what? Sarah's voice is quiet, dangerous. Instead of cleaning your floors, emptying your trash, doing work you consider beneath you? Webb's face flushes. That's not what I meant. Isn't it? Kowalski holds up a hand. Doc, he didn't mean disrespect. I know what he meant. Sarah looks at Webb directly. You think because I have credentials, because I have experience, that I should be doing something more valuable, something more worthy. She pauses. But you never looked twice at me when I was just a custodian. Never thought I might have something to contribute. Never considered that maybe the woman mopping your floors knew more about trauma medicine than you learned in 4 years of residency. The words land heavy. Webb opens his mouth, closes it. Sarah turns back to Kowalski. How did you find me? I didn't. I work here. VA rehab therapy, 4th floor. He gestures to his leg. Adjustments and physical therapy twice a month. I was coming back from an appointment when I heard 2 nurses talking about the custodian who saved that construction worker. He smiles slightly. Described you perfectly. The way you moved, the way you gave orders. I knew it was you before I even saw your face. Sarah's shoulders drop just slightly. How long have you been here? She asks quietly. 3 years, and you never recognized me before? You weren't in the medical areas. Different uniform, hair different. He pauses. And I wasn't looking. Wasn't expecting to find the angel of FOB Shank working custodial in a civilian hospital. Behind them, the crowd has grown. Residents, nurses, 2 attending physicians, environmental services staff who know Sarah by name, but never knew anything else about her. Dr. Patricia Reynolds pushes through the crowd, chief of medicine, the woman who called Sarah last night. She looks at Sarah, at Kowalski, at the crowd. My office, she says. Now, both of you. Sarah doesn't move. Reynolds' voice softens. Please, Major Chen, we need to talk. The title hits like a slap. Sarah hasn't heard it in 6 years, hasn't answered to it, hasn't been that person. I'm not a major anymore. No, Reynolds says quietly. You're not. But you're still a physician. You're still someone who saves lives. And right now, I need to understand why you've been hiding in my hospital for 6 years. Sarah looks at Kowalski, at Webb, at the faces staring at her with confusion and curiosity and something that might be respect. She thinks about running, thinks about quitting, thinks about disappearing again. Finding another hospital, another custodial job. Another place where no one knows her name or what it used to mean, but Kowalski is here. The truth is out. The past has found her whether she wants it to or not. Fine, she says. She walks toward Reynolds' office. The crowd parts to let her through. Behind her, she hears the whispers spreading. The story taking on a life of its own. The custodian who's actually a decorated war hero. A janitor who wrote the book on trauma medicine. The invisible woman who's been saving lives while everyone else looked right through her. In her pocket, the brass coin feels like it weighs 1,000 pounds. At 7:03 in the morning, Sarah is sitting in Reynolds' office when the trauma alert sounds. The overhead speakers crackle. Mass casualty incident. Multi-vehicle pileup. Interstate 101 northbound. Multiple fatalities. ETA 4 minutes. Reynolds stands. We'll continue this later. Sarah doesn't move. The second announcement comes 30 seconds later. Update. Mass casualty incident. Estimate 16 patients inbound. All available personnel to emergency department immediately. Reynolds is already moving toward the door. Sarah follows. They reach the ED as the first ambulances arrive. Paramedics shouting, gurneys rolling, blood everywhere. Dr. Webb is at the center of it, trying to organize, trying to assign. His voice getting higher with each new patient that comes through the doors. Bay 1, Bay 3, get me more hands in Bay 2. A nurse runs past. We've got a pediatric code coming in 30 seconds. Webb's face goes white. 4 patients in the trauma bays, 6 in the hallway. 2 more arriving. A resident frozen at the sight of a woman with her leg bent wrong, bone visible through torn jeans. Sarah watches for 5 seconds, then she moves. Not toward Reynolds, not toward Webb, toward the chaos. Her voice cuts through the noise like a knife. Listen up. Every head turns. Sarah stands in the center of the department, still wearing her environmental services scrubs, name badge still reading custodial staff. But her voice has changed. Command voice, officer voice. The voice that makes 19-year-old privates move without thinking and hardened sergeants shut up and listen. Triage assessment now. Red tags to trauma 1, yellow tags to trauma 3, green tags to the waiting area, black tags to the side bay. She points at the frozen resident. You. Femoral fracture in the hallway. Traction splint and pain management. Do it now. The resident moves. Sarah points at a nurse. You. The pneumothorax in Bay 2. Chest tube kit. Prep and assist. The nurse runs. Sarah walks to the worst case. A man in his 50s, chest crushed, steering wheel impact, breathing shallow and rapid. She puts her hands on his chest, feels the instability. Flail chest, multiple rib fractures, probably underlying pulmonary contusion. Webb. I need portable X-ray and oxygen at 15 liters, non-rebreather mask. Webb stares at her. You can't just move. Now. Something in her voice, something that doesn't allow argument. Webb moves. 4:18. In minutes, Sarah runs the trauma bay, not as a custodian, not as someone hiding, as Major Sarah Chen, Army physician, combat surgeon, the woman who kept 40 soldiers alive during a 12-hour firefight, when the medevac couldn't land and the supplies ran out, and the only thing standing between them and death was her and her hands and her refusal to let them go. She moves between patients, assessing, directing, her voice calm and clear and absolutely certain. Get me 2 units O negative for the abdominal trauma in Bay 1. Pericardiocentesis kit for the chest trauma in 3. Possible tamponade. That head injury is GCS 8. Intubate and get neurosurgery down here. The department transforms around her. Chaos becoming order. Panic becoming precision. At 7:21, a sound fills the air outside. Rotor wash. Deep. Heavy. Military. The windows rattle. Loose papers lift off the nurses' station and scatter. A Black Hawk helicopter is descending toward the hospital's helipad. The ED staff freezes. Military helicopters don't land at civilian hospitals. Not without authorization. Not without reason. Sarah knows what it means before anyone else does. Her hands don't stop working. Chest tube insertion on a 17-year-old girl who wrapped her car around a tree. The tube goes in clean. Air and blood drain into the collection chamber. The girl's oxygen saturation climbs. The trauma bay doors open. A man in army dress uniform walks in. Full bird colonel. Chest covered in ribbons and medals. Silver eagles on his collar catching the fluorescent light. He stops when he sees Sarah. His hand moves toward a salute. Catches himself. She's not in uniform. Not active duty. But the respect is there anyway. Major Chen. The room goes completely silent. Sarah ties off the chest tube dressing. Doesn't look up. Colonel. We have a situation. Chemical plant explosion 40 miles north of here. Mass casualty event. Estimate 200 injured, maybe more. Civilian infrastructure is completely overwhelmed. He pauses. We're requesting your assistance under emergency mobilization protocols. Sarah finally looks up. I'm retired, Colonel. I know, ma'am. His voice is formal, but there's something else underneath. Something personal. But you're still the best combat surgeon this country has ever produced. And right now, people are dying who don't have to. Webb steps forward. She's not military anymore. You can't just... The colonel's eyes shift to him. The look stops Webb mid-sentence. I'm Colonel Marcus Hayes. I was Major Chen's commanding officer for 4 years. I'd seen her keep a field hospital running during a Taliban offensive that lasted 3 days. He looks back at Sarah. I'm not ordering her. I'm asking her. Because she's the only person I know who can handle what's happening up there. Sarah peels off her gloves, the ones covered in the 17-year-old's blood. Around her, the trauma bay is stabilizing. Patients triaged. Treatments underway. The immediate crisis contained. She looks at Reynolds. The chief of medicine nods slowly. Go. Sarah looks at Webb, at the nurses, at the residents who dismissed her, and the staff who ignored her, and the people who never saw her until 5 minutes ago. I need a team. 6 people. Experienced. No residents. Webb straightens. I'll go. You're needed here. Then tell me what you need. Sarah's eyes scan the room. She points at 2 nurses, a physician assistant, an anesthesiologist who just arrived, 2 surgical techs. You, and both of you. Grab trauma kits and meet me at the helipad in 3 minutes. They move without question. Sarah turns to Kowalski, who's been standing at the edge of the room this entire time. Tell them what happened here, she says quietly. Tell them the truth. Which truth, ma'am? All of it. She walks toward the exit, toward the helicopter, toward the past she's been running from for 6 years. Colonel Hayes falls into step beside her. It's good to see you again, Sarah. Don't what? Don't pretend this is a reunion. Don't act like I didn't walk away. You walked away because you needed to, because you'd given everything and there was nothing left. His voice is quiet. I understood then. I understand now. But right now, people need you, and you're the only one who can help them. They read to the elevator. The doors open. Sarah steps inside. This doesn't change anything, she says. After today, I go back to being nobody. Hayes looks at her, sad, knowing. You were never nobody, Sarah. You just convinced yourself you were. The doors close. Through the trauma bay windows, Webb watches the helicopter lift off, watches it bank north and disappear into the morning sky. Around him, the ED is still controlled chaos, but it's functional now, organized, because of her. He looks at Kowalski. Tell me about her. Tell me who she really is. Kowalski's expression is complicated. Pride and sorrow, and something like reverence. She's the reason I'm alive. She's the reason 200 other soldiers came home. She's a legend we thought we'd lost. He pauses. And apparently, she's been emptying your trash for 6 years while you didn't even know her name. Webb's face burns. In the distance, the sound of rotor wash fades to nothing. The conference room at County General. 8:47 in the evening. Sarah sits across from Dr. Patricia Reynolds. The chief of medicine looks exhausted. They all do. 18 hours since the chemical plant explosion. 14 casualties total. 168 survivors. Without Sarah's intervention, the estimates put the death toll at over 80. Colonel Hayes sits to Sarah's left, still in uniform, still formal. Dr. Webb is there too. Kowalski, 2 other hospital administrators. Reynolds speaks first. I need to understand what happened in my hospital this morning. Hayes opens a file folder, slides it across the table. Major Sarah Chen, United States Army, 75th Ranger Regiment Medical Corps, 18 years of service, 6 combat deployments to Iraq and Afghanistan, Silver Star for extraordinary valor under fire, 2 Bronze Stars with Valor devices, Army Commendation Medal, Combat Medical Badge with Star. He pauses. Primary author and editor-in-chief of Advanced Trauma Life Support Under Fire, the field manual currently used by every NATO military force and adopted by 17 allied nations. Reynolds stares at Sarah. You're that Chen, the Chen. Sarah doesn't answer. Hayes continues. Major Chen left active service in 2018. Honorable discharge, full medical retirement benefits. Security clearance maintained at secret level. He closes the file. Specific reasons for separation are classified at her request. Webb leans forward. Classified? Why would... Because I asked them to be. Sarah's voice is quiet, flat. Everyone looks at her. She's staring at her hands, at the scars across her knuckles, small white lines from shrapnel, burn marks that never quite faded, the permanent reminder of what skin looks like when it gets too close to burning metal. I didn't leave because I wanted to. The room waits. Sarah breathes, in through the nose, out through the mouth, the way they teach you to control panic, the way you steady yourself before making the cut, or placing the tube, or telling a 19-year-old that his best friend didn't make it. Fob Shank, Forward Operating Base in Logar Province, Afghanistan. March 2018. Her voice is mechanical, clinical, the only way she can tell it. We took sustained mortar fire during a medevac operation, direct hit on the landing zone. 43 casualties in 6 minutes. Mass casualty protocols initiated. Silence. We had 1 functional operating theater, 2 physician assistants, 4 combat medics, supply lines cut, no air support, no reinforcements coming for 8 hours. She pauses. I had to triage. Webb's face goes pale. Red tags get immediate care. Yellow tags get delayed care. Green. Green tags can wait. Black tags are expectant, non-salvageable. Her hands clench on the table. I had to decide who lived and who didn't. Had to make those choices in seconds because every second I spent deciding was a second someone was bleeding out. Reynolds leans forward slightly. Sarah, I triaged a 19-year-old private as black tag. Catastrophic head trauma. Unresponsive. Fixed and dilated pupils. No gag reflex. By every field protocol, he was gone. Her voice cracks just slightly. I was wrong. The crack in her voice is worse than if she'd shouted. He died on the landing zone tarmac while I was in the OR working on someone else. Died because I walked past him. Because I decided his life wasn't worth the time it would take to try. She looks up. Her eyes are dry, hard. His name was Private Daniel Morrison, 20 years old, from Columbus, Ohio. He had a younger sister named Emma. He wanted to be a high school history teacher. Kowalski closes his eyes. Hayes looks down. I saved 42 people that day, Sarah continues. 42 soldiers who went home to their families. 42 lives that continued because I made the right calls. She pauses. But I killed Daniel Morrison. Not the Taliban, not the mortars, me. Because I looked at him and decided he wasn't worth saving. That's not, Webb starts. That's exactly what I did. Sarah's voice is sharp now. Don't sanitize it. Don't tell me I made the best decision with the information I had. Don't give me the speech about acceptable losses and the greater good. I've heard it. I've given it. It doesn't change the fact that I was wrong, and he's dead because of it. Reynolds speaks carefully. You saved 42 others. I know. Sarah's jaw tightens. I know the math. I know the calculus. 1 life versus 42. The needs of the many outweighing the needs of the few. I know all the arguments because I lived them for 18 years. She shakes her head. But I couldn't do it anymore. Couldn't be the person standing in the center, deciding who deserves to live and who doesn't. Couldn't make one more choice that meant someone's mother got a folded flag instead of a phone call saying their son was coming home. So you became a custodian, Hayes says quietly. I became someone who cleans up messes, someone who helps without having to choose, someone who doesn't stand at the center making life and death decisions. She looks at Hayes. You know what it's like, sir. You made those calls. You signed the orders that sent people into situations they didn't come back from. Hayes nods slowly. I do know. And I also know that leadership means carrying those decisions for the rest of your life. I carried them for 18 years. That was enough. But you're still saving lives, Webb says. Yesterday, today. You can't stop yourself. Sarah meets his eyes. Because I can't not. Because when I see someone dying and I know how to help, I can't just walk away. Even when I want to. Even when it means exposing everything I've been hiding. Her voice drops. But there's a difference between helping in the moment and taking responsibility for systems, for protocols, for deciding who gets resources and who doesn't. She stands. I'll help with disaster response when you need me. I'll intervene when someone's dying in front of me. But I won't be a physician, won't run departments, won't make policy decisions that determine who lives and who dies on a systemic level. She looks at Reynolds. I go back to environmental services, back to being invisible. That's the deal. Reynolds stands too. I can't allow that. You can't stop me from quitting. No, but I can tell you that you hiding your skills doesn't honor Private Morrison's memory. It dishonors it. Sarah freezes. Reynolds continues, voice gentle but firm. You think punishing yourself makes up for his death. It doesn't. You think making yourself small somehow balances the equation. It doesn't. She pauses. What honors him is using everything you learned. Ned from that mistake to save the next person, and the next, and the one after that. Sarah's hands are shaking now, just slightly. I can't go back to being that person. I'm not asking you to. Reynolds walks around the table, stands in front of Sarah. I'm asking you to be a new person. Someone who takes the skills and the experience and the hard-won knowledge and uses them. Not in war zones, not making black tag decisions, but here. Teaching, training, making sure the next generation of emergency physicians knows what you know, so maybe they don't have to learn it the way you did. Sarah looks at her, at Hayes, at Webb, at Kowalski, at the faces of people who finally see her. I don't know if I can. Yes, you do. Kowalski's voice is rough. You've been doing it already. Correcting mistakes, saving lives, teaching by example even when no one knew who you were. He stands, prosthetic leg clicking softly. You saved my life, ma'am. Saved it when everyone else had written me off. You didn't give up then. Don't give up now. Sarah closes her eyes. Behind her eyelids, she sees Daniel Morrison's face, young, smiling. The photo from his personnel file that she looked at every day for 6 months after he died. She opens her eyes. If I do this, I do it my way. No military protocols, no hierarchy. I teach what needs teaching, not what some curriculum says. She looks at Reynolds. And I'm not attending physician. I'm clinical instructor. I work with residents and students. I don't run departments. Reynolds nods. Agreed. Sarah pulls the brass coin from her pocket, sets it on the table. Kowalski's eyes widen. You kept it. Every day for 6 years. Why? Because it reminded me who I was, even when I was pretending to be someone else. She picks it up again. Private Morrison deserves better than me hiding. He deserves me being the person who learned from failing him, who makes sure it doesn't happen again. She puts the coin back in her pocket, looks at Reynolds. When do I start? 3 days later, Sarah walks into County General's emergency department at 6:30 in the morning. She's wearing navy blue scrubs, not environmental services gray, medical staff navy, a white coat over her arm. Her name embroidered across the pocket in dark thread. Dr. Sarah Chen, clinical instructor, emergency medicine. The department goes quiet. Then Dr. Webb stands from the nurses' station, walks toward her, stops 3 feet away, and bows. A full formal bow. Head down, respectful, sincere. I'm sorry. Sarah freezes. One by one, the nurses stand, the residents, the physician assistants, the environmental services staff, who worked beside her for 6 years and never knew. All of them bowing. We're sorry. Webb continues. His voice cracks slightly. We judged you, dismissed you, treated you like you were invisible. He looks up. You weren't invisible. You were extraordinary. And we were too blind and too arrogant to see it. Sarah can't speak. A nurse steps forward. Jennifer, 15 years in emergency medicine. She worked beside Sarah 100 times, never knowing. You corrected my mistakes, quietly, without making me look stupid in front of doctors or patients. Her voice shakes. You saved lives I didn't even know needed saving, and I never thanked you, never even learned your first name. Another voice, a resident. You taught me more in 6 months of watching you work than I learned in 4 years of medical school. And I didn't realize it until 2 days ago. Reynolds appears from her office. She's holding something. A framed certificate. Dr. Sarah Chen, in recognition of extraordinary service and dedication to patient care at County General Hospital. She hands it to Sarah. This goes on the wall in the main lobby, permanently, so everyone who walks through those doors knows who you are and what you've done. Sarah takes the certificate. Her hands shake. Just a little. Webb steps closer. I want to learn from you. We all do. Not because you're a war rare hero or because you wrote the field manual. Because you're the best physician I've ever seen work. And I've been too stupid to recognize it. Sarah looks at him, at the faces around her, at the people who looked through her for 6 years. You weren't stupid. You were human. Her voice is quiet. You saw what you expected to see. Someone in a custodial uniform doing custodial work. Your bias wasn't malicious. It was normal. And that's the problem. She sets the certificate down on the nurse's station. How many other people are in this hospital right now that you're not seeing? Environmental services staff who know more about infection control than half the residents. Nursing assistants who can spot a patient declining before the monitor's alarm. Transport staff who've been here 20 years and know this building better than anyone. The silence is uncomfortable now. I don't want apologies. I want change. Sarah looks around the room. I want you to see everyone, not just the people with medical degrees and white coats. I want you to listen when someone speaks up, regardless of what their name badge says. I want you to remember that intelligence and competence don't correlate with job titles. Webb nods slowly. How do we do that? You start by learning their names, by saying thank you, by respecting the work they do, even when it's not glamorous. She pauses, and you implement a protocol change. Anyone in this department, regardless of position, can call a patient safety concern. And when they do, you listen. You investigate. You take it seriously. Reynolds steps forward. I'll draft the policy today. Department-wide implementation by the end of the week. Sarah picks up the certificate again, looks at it. Her name, her title, recognition she didn't want, but maybe needed. Where do you want me to start? She asks. Trauma simulation training, Webb says. The residents need it. Hell, I need it. We've been running drills based on the textbook, but you've done this for real, in conditions most of us can't imagine. Sarah nods. This afternoon, simulation lab, 2 hours. Bring everyone who's interested. Everyone will be interested. At 2:15, the simulation lab is packed. 23 residents, 8 attending physicians, 12 nurses, 3 physician assistants, standing room only. Sarah stands at the front. Behind her, a trauma mannequin on a gurney, medical equipment arranged on tables. We're going to run a scenario, she says. Mass casualty, limited resources, multiple critical patients. You'll have to make choices. She divides them into teams, assigns roles, sets the parameters. You have 4 patients, 1 with a tension pneumothorax, 1 with an open femoral fracture and arterial bleed, 1 with a traumatic brain injury and declining neurological status, 1 with abdominal trauma and suspected liver laceration. She pauses. You have 1 OR immediately available, limited blood supply, 2 physicians, 4 nurses. What do you do? The room goes quiet. Webb speaks first. We triage, assess which patient has the best chance of survival with immediate intervention. Good. Show me. For 90 minutes, Sarah runs them through scenarios, real ones, based on situations she lived through. She's calm, patient, but demanding. When they make mistakes, she stops them, makes them restart, explains why. You're spending 45 seconds trying to get IV access on a patient who's bleeding out. External hemorrhage control first, tourniquet, direct pressure, then vascular access. Time matters. When they do it right, she tells them, good, that's exactly right. You prioritized correctly. Now tell me why. By 4 o'clock, they're exhausted. But they're learning. At 4:30, a real trauma comes in. Multi-vehicle accident. 3 patients. Sarah and Webb work side by side. He moves differently now. Faster, more confident. Using techniques she taught him 2 hours ago. The patients stabilize. Transfer to surgery. No deaths. Webb looks at her. That was smoother than anything we've done in months, because you're learning to think like someone who's done this 1,000 times, instead of someone reading from a protocol manual. Teach me more. That's the plan. At 6:45, Sarah is in the physician lounge when Kowalski finds her. You're really doing this, he says. Apparently. How does it feel? Sarah considers. Terrifying. Like I'm one mistake away from proving I shouldn't be here. You belong here more than anyone I've ever met. Maybe. She pulls out the brass coin, looks at it. Or maybe I'm just finally doing what I should have done 6 years ago. Stopped hiding. Stopped punishing myself. Started using what I learned instead of burying it. Kowalski sits down beside her. For what it's worth, ma'am, I think Private Morrison would be proud of you. Sarah's throat tightens. I hope so. I know so, because you didn't let his death be meaningless. You let it teach you, change you, make you better. He pauses. That's the best way to honor someone, not by destroying yourself, by becoming who they needed you to be. Sarah looks at him, at the man who was 19 when she pulled him from burning wreckage, who lost a leg but kept his life, who rebuilt himself into something new. You turned out pretty well, Kowalski. He grins. I had a good teacher. At 7:30, Sarah leaves the hospital, white coat folded over her arm, name badge in her pocket. She drives home in silence. But it's a different kind of silence now. Not the silence of hiding. The silence of someone who's finally stopped running. At home, she opens her laptop, starts drafting a curriculum, advanced trauma training for emergency residents, based on real-world experience, based on 18 years of keeping people alive when everything said they should be dead. On her desk, the brass coin sits next to a photo. 12 people in desert camouflage, standing in front of a medical tent. Dust and sun and tired smiles. She's in the center, younger, stronger, before the weight of command and the burden of impossible choices wore her down. She doesn't look away from it now, doesn't hide it. It's part of who she was, part of who she is, part of who she's becoming. Someone who teaches instead of hides, who builds instead of destroys, who honors the dead by saving the living. She works until midnight, planning, writing, preparing. Tomorrow she'll teach, and the day after that, and the day after that. Not as penance, as purpose. 18 months later, the lecture hall at Johns Hopkins University School of Medicine is packed. 400 medical students, residents from 6 different programs, attending physicians from hospitals across 3 states, standing room only in the back, people sitting in the aisles. On stage, Dr. Sarah Chen, 54 now, hair more gray than black. Reading glasses perched on her nose, navy scrubs under a white coat that actually fits. Behind her, projected on a screen 3 stories tall, Advanced Trauma Life Support Under Fire, 4th edition. Her name across the cover. Bold, clear, owned. She clicks to the next slide. Chapter 7. Triage under mass casualty conditions. Her voice carries to the back of the hall without a microphone. Command voice, the kind that makes people listen without knowing why. This is the hardest chapter I ever wrote. Hardest to live, hardest to teach, because it asks you to do something that contradicts every instinct you have as a healer. The room is absolutely silent. It asks you to walk past someone who's dying, to make the conscious, deliberate choice that their life is worth less than someone else's in that specific moment. She pauses, to become the person who decides who lives and who doesn't. She lets that sit. I want to tell you it gets easier with practice. It doesn't. Her eyes sweep the audience. Every time you make that call, you carry it. You carry the face, the name, the family they left behind. You carry it for the rest of your life. She advances the slide. A photo appears. A young soldier, 20 years old, smiling in desert camouflage, bright eyes, whole life ahead of him. Private Daniel Morrison. This is the man I failed to save. Fob Shank, Afghanistan, March 2018. I triaged him as black tag, non-salvageable, catastrophic head trauma. Her voice doesn't waver. I was wrong. He died on a landing zone tarmac while I was in surgery saving someone else. Died because I made the wrong call. The silence in the room is profound. That mistake is the reason I left military medicine. The reason I spent 6 years working as a hospital custodian instead of practicing. The reason I convinced myself I had no right to make life and death decisions anymore. She clicks to the next slide. 42 faces, the soldiers she saved that day. Some smiling, some serious, all alive. But these people live because of that same triage decision. 42 soldiers, 42 families, 317 children who have parents because I made the hardest call of my career and got it right 42 times out of 43. She turns to face the audience directly. You will make mistakes. You will lose patience you think you should have saved. You will lie awake at night, replaying decisions and wondering if you missed something, if you acted fast enough, if you were good enough. She pauses. But you will also save lives. You will be the difference between someone dying alone in an ED bay and going home to their family, between a child growing up without a parent and having them at their graduation. Sarah picks up the brass coin from the podium, holds it up so the light catches it. This was given to me by a patient I saved in Jalalabad. Staff Sergeant Timothy Kowalski. He lost his left leg, but kept his life. He found me 18 months ago when I was mopping floors and hiding from who I used to be. She sets it down gently. He reminded me that hiding doesn't honor the people we lose. Living does. Fighting does. Teaching does. Making sure the next generation learns from our mistakes, so maybe they don't have to make the same ones. A hand goes up in the third row. A young woman, medical student, maybe 25. Dr. Chen, how do you live with the mistakes? How do you keep working after losing someone? Sarah looks at her, really looks. You don't get over it. You integrate it. You let it change you, make you more careful, more thoughtful, more aware of your limitations. She pauses. Private Morrison's death made me a better physician, not because I wanted it to, because I refused to let him die for nothing. I refused to let that mistake be the end of my ability to help people. Another hand, a resident, older, maybe 30. Is it true you worked as custodial staff for 6 years? Yes. Why? Sarah considers the question. Because I thought I didn't deserve to practice medicine anymore. Because I thought punishing myself somehow balanced the equation. She shakes her head. I was wrong. Punishment doesn't honor the dead. Action does. Using everything you learned, everything you survived, to save the next person. That's how you honor them. She advances the slide. The new dedication page appears. For Private Daniel Morrison, and all those we couldn't save. Your loss demands we save the next one. And the one after that. And the one after that. Forever. When someone tells you your methods are outdated, your approach is wrong, your background doesn't matter, Sarah's voice strengthens. Prove them wrong. Not with words, with results, with competence, with the quiet confidence that comes from knowing you've done this before and you can do it again. She clicks to the final slide. A quote. Simple, direct. The best way to honor the dead is to fight like hell for the living. The auditorium erupts into applause. Sarah doesn't bow, doesn't wave, just nods once and walks off stage. In the parking lot 20 minutes later, Dr. Webb catches up to her. He drove 3 hours from County General. Errol to be here. That was incredible. Sarah unlocks her car. It was necessary. The students loved it. The faculty loved it. You're changing how we teach trauma medicine. He pauses. You're changing everything. Good. It needed changing. Webb hands her an envelope. Reynolds asked me to give you this. Sarah opens it. Inside, a formal letter. County General Hospital is establishing the Sarah Chen Center for Emergency Medicine Excellence. Dedicated to training the next generation. Funded for 10 years. We broke ground last month, Webb says. Opens in 6 months. Reynolds wants you to direct it. Sarah stares at the letter. I'm not an administrator. You're a teacher, a leader, someone who knows what matters and isn't afraid to fight for it. He smiles. Say yes. Sarah looks at him, at the man who dismissed her, who learned, who changed. I'll think about it. That's not a no. It's not a yes either. She gets in her car, starts the engine. Through the open window, see you next week, Dr. Webb. He watches her drive away. On her passenger seat, the 4th edition of the field manual, dog-eared, annotated, used. And beside it, the brass coin, catching sunlight. She glances at both, allows herself a small smile. At a red light, she pulls out her phone, opens her contacts, scrolls to a name she hasn't called in years. Emma Morrison, Daniel's younger sister. Sarah met her once. At the funeral. Couldn't speak. Couldn't explain. Could barely breathe. She types a message. This is Dr. Sarah Chen. I served with your brother. I'd like to tell you about him, if you're willing to listen. About how his life and his loss changed me. How he's still saving lives even now. how I'm trying to honor him every single day. She stares at the message for 10 seconds, hits send. The light turns green. Sarah drives, not away from the past, not hiding from who she was. Forward. Toward whatever comes next. Toward the center that will bear her name. Toward the students she'll teach. Toward the lives that will be saved because she finally stopped running and started building. In her rearview mirror, Johns Hopkins disappears. Ahead, the road stretches out, clear, open, full of possibility. She turns on the radio, something she hasn't done in years. Music fills the car, not loud, just present. She drives home, to the apartment that's slowly becoming less empty. That has photos on the walls now. The team at FOB Shank, Kowalski in his PT gear, a picture from last month, her and Wed and 6 residents after a successful trauma simulation. Life, messy, complicated, real. She pulls into her parking space, sits for a moment. Her phone buzzes. A response from Emma Morrison. I'd like that very much. Thank you for reaching out. Daniel talked about you in his letters, called you the best doctor he'd ever met, said you cared about every single soldier like they were your own family. I always wanted to thank you. Sarah's vision blurs. She wipes her eyes, types back. He deserved better than what happened. I'm sorry I couldn't save him. But I promise you, I'm spending the rest of my career making sure what I learned from losing him saves everyone I possibly can. He matters. He'll always matter. Send. She sits in her car for 5 more minutes, then gets out, goes inside, makes dinner, works on curriculum plans for the new center, answers emails from residents asking questions about trauma protocols, lives, not perfectly, not without pain, but forward, always forward. On her desk, the brass coin sits next to a new photo, the groundbreaking ceremony for the Sarah Chen Center. Reynolds, Webb, Kowalski, 20 residents, environmental services staff, everyone who saw her. Finally, she picks up the coin, feels its weight, puts it back down. Tomorrow, she'll teach. And the day after that, and every day after that for as long as she can. Not as penance, as purpose. The angel of FOB Shank didn't die when Private Morrison did. She just learned to fly differently.